Hi, everyone. My name is Dr. Amy Taylor, and I'm an assistant professor with the Earl E. Bakken Center for Spirituality and Healing. I'm a physician who's dual board certified in emergency medicine and integrative medicine, and welcome to Mini Medical School. I'll be your moderator for this evening as we guide through our topics, food, nutrition, and the effects of substances on health. Our panel of experts and I are all really looking forward to guiding you through our first topic tonight, laying the groundwork, nutrition, aging, environmental health, and more. Just a few housekeeping items. We'll be starting with a moderated discussion tonight with our panelists, followed by a question and answer session. Note that you can submit your questions anytime using the Q&A button at the bottom of your Zoom screen. Also, please note that we will be recording tonight's session, and it will be available tomorrow on the Office of Academic Clinical Affairs YouTube channel, and you'll be sent a link for this in your email. All right, well, let's go ahead and get started. We have the privilege of speaking with a wide range of experts on current nutritional guidelines in the United States, nutrition across the lifespan, and the relationship between what we consume, the environment, and food insecurity. I'm going to now introduce our first panelist, Dr. Abby Gold. Dr. Gold is a health and nutrition extension specialist at the University of Minnesota Extension Center for Family Development. Dr. Gold's research focus is public health, nutrition, communication, and community-based public health program assessment. She is actively involved in developing access to healthy foods at a state and local level. Dr. Gold's current intervention research revolves around discovering ways to understand the relationship between food, nutrition, and health in individuals and populations as they live in communities. Dr. Gold, welcome. Can you please discuss USDA dietary guideline recommendations across the lifespan?
I can do that, and I'm going to share my screen right now. So thank you very much for having me tonight. I'm really excited to talk about some of the best data and information that we have right now for Americans across the lifespan. And I'm going to highlight tonight kind of just an overview of the dietary guidelines for Americans and the recommendations, because we don't always think about that document as something that's really a driving force in our lives. So I want to kind of emphasize that. And then I want to talk about the Mediterranean diet, because it really has taken a prominent place within the dietary guidelines, or at least this 2020 version. And so I think it's worthwhile to start examining and thinking through the Mediterranean diet and how to incorporate it into our daily lives. So one thing that has become really clear is that we talk about the dietary guidelines, and some people think that it may not really be something that addresses our, how we live on a day-to-day basis. But if we were really true to the dietary guidelines, we would know that it really is a plant-based kind of diet, if you want to call it a diet, or the recommendations within the dietary guidelines. And we also see that through the lifespan, we do not even come close to eating the recommendations that our best science has put forward. And so we see we actually have our lowest point at ages 14 to 18. And this is comparing ages to the Healthy Eating Index, which measures how closely food and beverage choices align with the dietary guidelines. So right at that point, ages 14 to 18, when we're really laying down bone, when we're supposed to be at the peak of our health, we're actually eating very I guess you could say unhealthily. The highest peak is ages 2 to 4, and then over 60. So that's just a little context about the dietary guidelines and the fact that Americans aren't really even coming close to meeting the recommendations. So what are the dietary guidelines for Americans? The dietary guidelines provide science-based advice on what to eat and drink to promote health and reduce the risk of chronic disease through meeting our nutrient needs. And we have a new word for that now, and that's called nutrition security. Food insecurity is something that Melissa Horning will address after my talk, but we really should start thinking through not just food as calories, but food as nutrients and health. And so the dietary guidelines really serve as the cornerstone for how we think through our policies around federal nutrition programs, and such as the National School Lunch Program, the Women, Infants, and Children Program, and there are many more. And the dietary guidelines are really mandated to reflect the preponderance of scientific evidence that that we have at the time that the dietary guidelines are written. And that's the beauty of science, is that it's always growing. We're always learning more. So of course the dietary guidelines are going to change over time. And they're written for a professional audience who is really their charge is to, like someone like me, to help translate that science. And the focus in the dietary guidelines is really on nutrient density, and like I said, the nutrition security concept. And the core elements that make up a healthy dietary pattern include vegetables of all types, fruits, especially whole fruit, grains, at least half of which are whole grains, dairy, including fat-free or low-fat milk, yogurt, cheese, and lactose-free versions. And then protein foods, including lean meats, poultry, seafood, beans and legumes, and nuts and seeds, and soy products. And then also healthy oils. So monounsaturated fats like olive oil, grapeseed oil, and other polyunsaturated fats, things that we find in seafood and nuts. So those are really the basis of the pattern that the dietary guidelines is shaped after. And so within the US, if you can see this slide, you can kind of see what the recommendations are for the different age groups, and the number of calories that are recommended. And then based on the number of calories, how many servings of each food you would eat in a day. But like in my experience, it's not necessarily what you eat on a daily basis. It's the average of what you eat over a week's period of time. So a lot of us tend to track what we're eating on a day-to-day, hour-to-hour basis, and then maybe beat ourselves up if we don't follow a specific pattern or a specific goal that we have in mind. But I want to kind of suggest that we refrain from doing that to ourselves, and think of our diets as more like a pattern rather than a day-to-day, minute-to-minute, portion size to portion size type of mindset. And so that's why I really think that the Mediterranean diet, that now the dietary guidelines has really come out and said, hey, this is a really great example of a pattern that's worked really well across the world, around the world, to induce health benefits. And really, Ansel Keys from the University of Minnesota did this 7-country study, and in the late 50s and 60s, which included Greece, Italy, and Croatia. Sorry, and he found the association between this dietary pattern of monounsaturated fats and lean meats and fermented foods like yogurts and fruits and vegetables really had an effect on decreasing the risk for cardiovascular disease. And since then, there have been many studies that have looked at the health benefits of the Mediterranean diet. And it can vary across all the different countries in the world that follow the diet, which would, include Turkey, Greece, Croatia, Italy, Portugal, Spain. And so there's been lots of not just research in the United States, but all around the world looking at this dietary pattern and finding things like a reduced risk of diabetes and improved outcomes for people with diabetes, and then also improved blood sugar through the increasing the GLP-1 factor, which helps to control blood sugar. Also looking at dyslipidemia biomarkers and seeing improvement there, decreasing the risk of certain cancers, and even cognitive decline and improved outcomes for dementia. And then the last one, which really interests me right now, is the beneficial remodeling of the gut microbiome, which is something that we're learning more and more about. And there's so much, it's like the new frontier. It's like space, actually. There's trillions of organisms that live inside of us, and we don't know all of the health benefits that are obtained from that symbiotic relationship that we have with the microbiome in our bodies. And the Mediterranean diet has been shown to have positive effect on the microbiome. And so some of the attribution to the benefits comes from the monounsaturated fats and the reduction of saturated fats. So like things that we eat a lot of that we think taste really good, like red meat and butter, with saturated fats. If we focus on the monounsaturated fats, we're going to see benefits. And also an increase in antioxidants through an increase in fruits and vegetables, fiber, and other phenolic compounds found in plant foods. So that's some of the reason why we believe the Mediterranean diet is having positive effects. So UNESCO, which kind of, if you go around the world, we think of UNESCO as places, but UNESCO also has a thought about the Mediterranean diet and the lifestyle around the Mediterranean diet as a set of skills, knowledge, rituals, symbols, and traditions concerning crops, harvesting, fishing, animal husbandry, conservation, processing, cooking, and particularly the sharing and consumption of food. So along with the Mediterranean diet is a whole gastronomical culture that, whether or not we adopt that whole idea of the Mediterranean diet in the United States, that's to be determined. Just before I close up, I have two more slides, and one, I really love this slide because it's so simple. And also you see here, this diet came from our extension website called Real Life Good Food. We have great recipes on that website and lots of other information. But you see here a sample daily menu that doesn't look that complicated, and it also looks actually super delicious. So, but then I also want to emphasize that you can also perhaps eat a Mediterranean diet on a budget. And like canned fish, for example, my favorite. Not everybody loves it, but maybe it's something that grows on people. But wow, there's so much, like if you're eating canned sardines, you get all those healthy fats. And so the recommended, perhaps eating on a budget, using low sodium frozen canned fruits and vegetables, beans, and canned fish, frozen fruits and vegetables, in season fresh produce, buying grains, nuts, and seeds in bulk, dried beans. And also, I already mentioned the canned fish twice. That shows how important it is. So, one thing that the dietary guidelines doesn't talk a whole lot about is if you're eating on a budget and if you're experiencing food insecurity and nutrition insecurity. And so I think Melissa Horning's going to talk more about that, and I'm going to let her introduce that topic.
right. Thank you so much, Abby, for your knowledge and expertise on that. And I'm so excited that you talked about the Mediterranean diet. When I'm talking with patients, I say one of the single best things you could do for your health is switch to a Mediterranean diet because it has so many wonderful health benefits. So thank you so much. And now we're going to move on to Dr. Melissa Horning. So Dr. Horning is an associate professor in the School of Nursing, and Dr. Horning's current research focuses on enhancing access to and consumption of healthy foods. Dr. Horning strives to develop sustainable solutions for improving food access and food security in collaboration with the community. And welcome, Dr. Horning. Can you please discuss impacts of nutrition and food insecurity across the lifespan?
I will certainly do my best. Let me share my slides here. It is a real privilege to be with everyone this evening. My work within nutrition and food insecurity began in practice as a public health nurse out in the community. In the community, I worked with individuals across the lifespan, and no matter where I was working, food came up. Specifically, my clients were concerned with how to access food, how to afford food, cook food, and get their kids to eat well. And as such, it naturally became the focus of my program of research. So it's really fantastic to have this opportunity to speak tonight on the impacts of nutrition and food insecurity. But before I get started, I'd like to disclose that I have nothing to disclose. But as Dr. Gold spoke about nutrition across the lifespan and recommendations, clearly nutritious food is a cornerstone to health and well-being. And nutritious food intake is essential for healthy growth and development of our children and are all ages across the lifespan. Nutritious food supports mental and physical health in a variety of ways by both preventing and helping to manage chronic health conditions like heart disease and diabetes. And nutritious food can help with healing and recovery from illness and aging well. But unfortunately, not all have access to the food they need to live a vibrant and healthy lifestyle. While I think we can all agree that the pandemic did not have much for silver linings, for me, one of the silver linings is that we began talking about food insecurity. Perhaps you remember the headlines and the pictures of people waiting in line to receive food assistance in the news. Food insecurity was here long before then, and it has continued to persist long after those headlines faded. But we're here talking about it now. Food insecurity is the limited or uncertain access to adequate food. Or in other words, to put it simply, food insecurity is worrying about or actually running out of food. The opposite of food insecurity is food security, and that's defined where a person has enough food to live a productive and healthy life. But as Abby was talking about, recently there's been this move into nutrition security, and that goes beyond just having enough food, but that there's equitable access to healthy, safe, and affordable foods. And this is going to be a really powerful shift for the field. And while we're moving into this direction and moving towards using into measuring nutrition security, for the time being, we're stuck with food insecurity and food security because it's what we have the most data on. What we do know is that food insecurity impacts 1 in 10 Americans, and we know that that burden is not equitably distributed across our communities. This graph from Feeding America makes it easier to see the disparate impacts, with those most likely to be affected by food insecurity being those that identify as Native American, Black, Pacific Islander, or Latino or Latina. Additionally, we know that food insecurity affects adults with a disability, households with young children led by single adults, and families of young children at higher rates than the national average. We also know that food insecurity does not distribute equitably geographically across our state or any other state for that matter, with the areas of red on this map indicating much higher projections of food insecurity. Food insecurity is caused by many things, and social determinants of health, the conditions in which we live, grow, work, and play, are large contributing factors. One social determinant of health is structural racism. Structural racism contributes to food insecurity through historical and current chronic disinvestment in communities comprised predominantly of people of color. Structural racism also contributes to food insecurity based on where full-service grocery stores choose to build and operate. Economic instability and limited employment opportunities also contribute to food insecurity. When faced with multiple competing basic needs, for example, housing, heat, and food, as my community partners at the food group like to say, food is most flexible. And this infographic from the Minnesota Food Shelf Survey demonstrates that. People visiting food shelves were reporting that they had to choose between food or utilities, transportation, housing, education, and childcare expenses. And food affordability varies the nutritional quality of foods that can be purchased. The food budget just doesn't go as far with purchases of nutritious foods. Even if you're doing all of Abby's tips, consider whether 3 packs of ramen or 1 apple, which are about the same cost, similarly fill up a tummy. We also know that based on location, the types of stores available in your community might make prices vary dramatically, with smaller stores tending to have both higher prices and lower quality foods. And moreover, food access is limited in areas of orange on this Minnesota state map. And the orange indicates that the communities are experiencing both low income and low food access at a half mile in urban areas and 10 miles for rural areas. This map is similar, and it shows the Twin Cities metropolitan area. And again, the communities in orange are those that are experiencing low food access and low income. And as you can see, food access, just like food insecurity, isn't distributed equitably across our state or our communities. And perhaps if you have transportation, living in an area without access might not make a big difference. But without solid transportation, limited food access may greatly influence what foods you can purchase and at what price, contributing to food insecurity. And one of the multitude of reasons food insecurity is problematic, in addition to that food is just a basic human need, is food insecurity contributes to and worsens health inequities related to nutrition, weight, and other health conditions. Food insecurity contributes to a host of poor outcomes that are not only those that are immediate, that often come to mind, like hunger or malnutrition or stress, but those that are long-lasting, such as heart disease, diabetes, depression, anxiety, and even suicidal ideation in adults. For children, being food insecure is associated with depressive symptoms, reduced concentration, poor school performance, developmental delays, dysregulated behavior, more frequent illness, and more emergency department visits and foregone medical care. Consider how these outcomes for children could affect their entire life trajectories. Clearly, food insecurity is a major health problem. And it adds considerable cost to healthcare every single year to the tune of $77 billion. There are programs with good evidence that they reduce food insecurity. So that's the great news. And these include the National School Lunch Program, the Supplemental Nutrition Assistance Program, and the Women, Infants, and Children, WIC, Nutrition Program. And there's also growing but very limited evidence on food as medicine programs like food prescriptions or medically tailored meals, and that these programs might also reduce food insecurity. And then other initiatives, including mobile food markets and summer food service programs, are being evaluated even here at the University of Minnesota School of Nursing in partnership with community to evaluate their impact on food security. This research evidence is important to help us better understand and have evidence on which initiatives work, for whom, and why. Now, if you, a loved one, or a neighbor are experiencing food insecurity, Hunger Solutions hosts the Minnesota Food Helpline, and this helpline can help you learn about your own SNAP eligibility and even assist with your application. They can help you find food from a local food shelf, a free meal or discount grocery program, or a farmer's market that accepts market bucks, which increases your SNAP spending power. And should you want to just take action to address the broader impacts of food and nutrition security on the health of our neighbors and our communities, there actually are things you can do. First, make sure you understand the impact of food insecurity on health and well-being. Second, work with organizations or groups you're affiliated with to screen for and address food insecurity. Third, consider personally or through your organizational affiliations to support the local community efforts to address food and nutrition security in your community. And finally, be an advocate. Advocate for those that are struggling with food insecurity by calling for changes in policy and legislation. For example, call a legislator, encourage them to address upstream contributors to food insecurity. For example, supporting livable minimum wages, education equity, affordable housing, affordable healthy food access, and request additional support for individuals experiencing food insecurity. For example, by increasing eligibility and provisions provided by food support programs like SNAP or WIC, or even the Minnesota legislative supported Market Bucks program. Food insecurity detrimentally impacts health, and there are things you can do. Please join us in this work. My references, and then I would be remiss if I didn't actually acknowledge my community partners who have partnered with me for my work and who work diligently every day to address issues like food access and food insecurity, as well as my research teams and my funders that have allowed our community partnerships to be able to focus on addressing food insecurity and food access in our community. And with that, I look forward to your questions in our discussion this evening.
All right. Thank you so much, Melissa. That is such an important topic with food insecurity. And I can definitely attest as an ER doc, people have come into the emergency room because they literally did not have access to food. So it really is an important problem. And thank you so much for your expertise on that. All right, now we move on to our final panelist, and it's my pleasure to bring in Dr. Jennifer Schmidt. Dr. Schmidt is a senior research scientist in sustainability at the Institute on the Environment. Her research focuses on tracing environmental impacts through agricultural supply chains, understanding systems of food recovery and food waste, and circulating byproducts back into production systems. She leads research on the food system supply chain sustainability, which works with consumer-facing companies to help understand their supply chain environmental impacts. Dr. Schmidt, welcome. And can you please discuss how extreme weather conditions around the world impact food production and what effect patterns human consumption have on the environment?
Thank you, Amy. And no, I can't talk to all of that. We changed the topic a little bit to narrow it down to focus on environmental impacts of food consumption from a life cycle perspective, because the ask previously was basically a degree from the University of Minnesota. So forgive me as I try and narrow it down tonight. But yeah, I am going to talk about something different than the previous panelists, but another added layer of importance when we think about food and nutrition and health is thinking about the environmental impacts. And I know it's something that I think a lot of us have heard about, at least in the public sphere, if not from friends and family. So let's go to the next slide real quick. I also don't have anything to disclose. And then the next slide. So I mentioned, right, that food production matters from an environmental perspective. That's what I'm going to talk about today. But to kind of put some more numbers behind that and highlight why we need to think about the environmental impact of food production. A quarter of the world's greenhouse gas emissions come from food production. The impact from a water perspective is actually much greater. So thinking about the water use embedded in agriculture to produce our food, 70% of the world's fresh water withdrawals are used for agriculture. And then thinking about the land required to produce the food that we globally also consume, about half of the world's habitable land is used for agricultural production. And of that, more than 3/4 of that is for livestock production, despite the fact that meat and dairy make up a much smaller share of the world's protein and calorie supply. But a large part of that land use is for, again, livestock. America's diet, when we think about, it's kind of a global perspective, America's diet is about double in terms of its consumptive use of greenhouse gas emissions, water, and land use than the average world diet. And most of that impact comes from animal use. So we'll go to the next slide. So let's dig into, well, how do we think about this environmental impact? And as I found out that my colleagues were talking about human lifespans and food across them, I said, oh, when we think about environmental impacts, we think about them across a lifespan as well, only we usually talk about it as a life cycle. But if you think with me for a moment about what it takes to make food, there's a value chain, right? We have to produce something. We have to have land and farm it. If we're making something like milk, we farm those crops that then feed to animals. That goes to processing. We transport that, take it to a grocery store. We take it to some warehouses and then a grocery store, package it, or I guess, or packaging before the grocery store. See, there's so many steps in this whole chain. Get to the grocery store, but then you got to drive to the grocery store or to the restaurant to consume that, bring it home, potentially waste it. And all of that lifespan of the food all matters from an environmental perspective. And so that's what, how we start to think about the environmental impacts associated with food, or really environmental impacts of anything, but again, focusing here today on food. And again, we often call that a life cycle perspective rather than a lifespan perspective. And there's a method of accounting for that environmental impact called a life cycle assessment. And that's that circle I show you there, that there are resources, right? A whole slew of things we do to create the food, we use it, and then actually let's think about the end of life. And so sometimes we also talk about it as a cradle to grave perspective. Okay, so let's go to the next slide. Thank you. If we look at now thinking about this life cycle perspective of what is embedded in making food, all of the stages, we can see that their amount of impact that a food has varies by those stages. And so in these graphs, just big picture, because depending on how close you are to your screen, it might be harder to read, but the different colors are different life stages. So the green is land use change embedded in these. The brown is the farm stage. Blue is processing, right? See, that's pretty small there in terms of the total impact of that environmental piece of those different meats. So we've got beef at the very top, and I've got all beef or all animal products on the graph on your left, and then some non-animal products on the bar chart on the right. And I again want to point out that the impact varies across those different life stages of that food. So kind of where we would impact the environmental emissions of producing something matters best depending on where the impact occurs in that food. Also, as is probably pretty evident in something you guys have heard, animal-based products have the highest from a greenhouse gas perspective, and that's what these bar charts are showing. Impact. In fact, the rice on the right would fit right underneath eggs if we were to combine these two bar charts, and then everything else there would go underneath milk. And another thing I want to point out on this graph, just because it's a common area of misconception, is that the transport, which is in pink, doesn't show up hardly at all in the animal products pieces, and it's still not the largest and often not the second largest impact on some of these other crops or food products on the right hand side. And so this idea that like the amount of impact that moving your food has on the total environmental impact of that food is actually usually really small and often single digit, like 1% of total emissions come from transport of most, especially animal food products, for instance. Okay, go to the next slide. So with this life cycle perspective, what I'm sure many people want to know and is often asked of me is, what is the impact of my food? And then I get to be really academic and boring and say, well, it depends. But I want to explain a little bit why it depends as we think about the environmental impact of food, to bring nuance to your own thinking around this question and your own decision making on what you want to do in terms of your food consumption. So let's go to the next stage or next slide. So one of the things that depends on is how we think about that impact. All right. So on the upper, the full blue bar is the food ingredients that I was able to pull from that little chicken sandwich. I've got some poultry meat, eggs that goes into the mayo that was in there, tomatoes, wheat and rye that goes into the bun. Obviously, there was other pieces of that picture, but I didn't have data on all of those. But like thinking about the environmental impact of that sandwich and those different ingredients in that sandwich based on per kilogram of food that was produced. So that's on the left-hand side, the blue bars, right? So if you're looking at a per kilogram of food product, poultry meat is the highest greenhouse gas emissions of kind of what was embedded in that sandwich. And again, that shouldn't surprise you. That's what we often think of. But another way to think about this is, what is the environmental impact, not per kilogram of food, but per kilocalorie? So that's the picture on the right, where we've got tomatoes popping up as kind of the most impactful part of that sandwich that I showed you on the previous slide. Now, we're not eating 2,000 calories of tomatoes. So it's not always even the most useful to think about per kilocalorie. Sorry, but what your perspective you're bringing to that environmental impact and how you're kind of slicing it matters in terms of what the impact of that food has. And Dr. Gold mentioned before, like now the nutrition space and the food science nutrition space is thinking about food as nutrients. So we could think about the environmental impact or the greenhouse gas impact of chicken versus tomatoes in a per nutrient basis. And so then we'd have to get the nutrients the same and think about them that way, which is a really hard thing to do because we eat chicken for a different reason than we eat tomatoes. And so again, this complexity is brought in when trying to figure out how we talk about the impact of food. Go to the next slide. I'm going to further muddle things for you in that in thinking about the total impact of food, here we have beef and beef. The top one is beef, and this is herd, like a feedlot beef. And the second one is dairy beef. So we do eat beef that comes from dairy cows. It's very common in our supply chain. And the environmental impact of, let's say, a hamburger made from dairy beef versus feedlot beef differs, not for some grand reason, but because when we think about environmental impact, most of the environmental impact of a dairy cow, we attribute that impact to milk and not to the beef. The beef is like a secondary product. And so you have this allocation, is what it's called, of a lower environmental impact to that hamburger patty. And then also here, this kind of life cycle perspective I've been showing you, we have these different stages. This one actually doesn't even include waste. And so it's, cradle to full grave is the waste stream. And so I'll go to the next slide. We also have to think about food waste. Oh, they're out of order. Go one more and then we'll go back. Sorry. Think about food waste as part of this total impact of our food. And I'm sure you've heard the statistics about over a third of the food that we eat is wasted, and that is absolutely true. And that has a lot of embedded environmental impacts. It has embedded water that we put into that food, and fertilizer applied to that food, and land that we use to crop for that food that then we're just then throwing away. And so that also brings an impact into our accounting of the total environmental footprint of food. So with all of that, now you can go back to the previous one, my apologies. What is a person to do? It's a complicated situation, and I just didn't want to leave everyone totally going, oh, it depends, it doesn't matter. It does matter. What you eat does matter. You can make a difference. But be mindful, think of this whole life cycle perspective, and ask yourself when you're seeing statistics about the environmental impact of something, like, do they have a reason for allocating one way or the other? Are they talking about the full life cycle perspective? Or maybe the science is still unfolding and we're still trying to figure out pieces of that entire life cycle perspective. In general, right, plant-based products have lower environmental footprints. So choose to eat more of those. Eat local because you care about your community and because you care about your local farmers, but not necessarily because you care about the sustainability impacts. Again, transportation is a really low piece of that entire footprint. Waste less. I mean, we had a whole conversation about food insecurity, and we are throwing away perfectly edible, safe, desirable food, not, of course, at the household level, but at grocery store levels, at retail manufacturing levels, and promoting food recovery efforts that can take that safe, desirable, edible food and get it to people is important. It's also a Band-Aid for larger systemic problems. So don't think that we can just waste less and solve food insecurity. Don't. And then I just kind of want to end on saying, there are other reasons that we eat food. That's important to think about the planetary effect. Be kind to the planet, but also be kind to yourself. With that, you can go to the last slide, and thank you.
All right. Thank you so much, Jennifer, for your knowledge and expertise on that. I know I often talk with my patients about eat more plants, and I think it's not only good for their health, but really good for the environment as well. All right, so we are going to progress now into the question and answer portion of our session. And just as a reminder, you can submit your questions at any time using the Q&A button at the bottom of your Zoom screen. Our first question is for Abby. What should one look for when trying to maintain a healthy and balanced diet in the face of allergies, one's own or others in the family?
Well, food allergies are something that you know about often through trial and error. And you learn about how different foods make you feel and what different foods make you react. So one thing that's really helpful to learn about your food allergies is keeping a journal of what you've eaten and how those foods have made you feel, and keeping track in that way, and then really getting to know yourself. And then if you have a family member that has a food allergy, depending on the severity of the allergy, because some people have such bad allergies they can, have like an anaphylactic shock reaction. You'll want to also understand the severity of if they're exposed and reduce the exposure through any cross contamination. You could have a whole session just on food allergies, but so I think I'll leave it at that. But just really getting to know yourself and what foods affect you in different ways.
Okay. Thank you so much, Abby. Our next question is for Melissa. Regarding food access, is that indicating a lack of grocery store in the area? And what is considered to be a food access area? Is it 5 miles or 10 miles from home or within walking distance?
Yeah, that's a great question. So in terms of food access, it often is referring to like store availability, but your store is only as available as you can get there. And so like the map I was showing that had the orange, that's called the Food Access Atlas, and it's hosted by the United States Department of Agriculture, and they measure it as in sort of your access to a supermarket. So like your corner store or like a convenience store wouldn't count. And so like that would still be some level of access. Lots of people are getting food from dollar stores. Those things wouldn't count on that map, but this would be like kind of like your full service grocery store. And so in rural areas, it's the picture I chose was from 10 miles. So like you'd have to drive at least 10 miles or go 10 miles to get to that grocery store. And if it was beyond that, that area would light up as orange. And in urban areas, it's said to be a half mile. And again, like think about carrying your groceries a half mile. And, if you're buying for a family, like what that would take to like lug or how you would haul that on public transit. And so that's quite a distance, even though it doesn't seem very far numerically.
Okay, thank you so much. All right, our next question is for Jennifer. Are plant-based diets healthier for an individual and for the planet?
The first question I'll defer to the 3 other people on my panel. And generally, yes, they are healthier for the planet. Although
That's a hard question to answer. I agree with the 3 points that the person made, and which is why I kind of emphasize the canned fish in a way, because it's lower on the food chain. those little fish, those sardines, are more prolific, they're more available. I mean, eating them once a week or once a month, or just adding them in whenever you can, if you're not eating them at all, is another kind of perspective. So really what we're after with the fish is the healthy fats and the lean protein. So I would say that you could obtain some of the healthy fats from like some of the oils like flax oil, or the monounsaturated oils, and also eating beans and legumes for, you know, some of the lean proteins. But you know, eating local fish whenever you can, if you can, you know, find a safe lake or a river to eat them from, not, you know, follow the recommendations by, like, our DNR puts out recommendations about different lakes and, you know, whether you can eat the fish from those lakes, and if so, how often. So just really knowing what you're eating, where you're sourcing your fish from, if you do eat it. But I share the concerns that that person wrote as their question.
Wonderful. Thank you so much. All right, our next question is from Melissa. Have apps like Uber Eats, DoorDash, and Instacart had a positive or negative impact on food access? And how can we leverage such services to reach populations?
This is just like a phenomenal question. And so the answer is yes, it's impacted food access. I think the question is, has it impacted food access equitably for folks that have financial resources? Like, those types of apps make things very accessible, and like the price tag sort of bump that may come with them, or like delivery charges, tips, those types of things aren't a problem. So in that case, absolutely increasing access. The question is, does it on the flip side increase access for folks that are really struggling and are experiencing low incomes, or experiencing food insecurity? And I think the jury is not fully out on that. I think there's probably a lot of research that's currently being done, but like a student on my team and I work together on a project. And so I work with the Twin Cities Mobile Market as one of my research partners, and they're amazing. And so they're pricing their foods, and they kind of wanted to know, like, where are they relative to other stores? And we also then had an online component of, like, if we went to the same 4 sort of major retailers, what would it cost in the online world? And like, the costs were higher, and like there was like a delivery fee, and there were tips. And so like, even if you're like part of their members, there's like all of these extra costs that are sort of baked into that. And like, one of the stores that we were pricing at actually like had a big upcharge, and so like their in-store purchases were actually quite reasonable and like kind of on par with the Twin Cities Mobile Market. But then if you actually needed it like to be picked up or delivered, you all of a sudden had like a 20% increase in the price of that same cart. And so I think it's a great question. I think it could be leveraged, and there could be ways in which like that could solve a lot of food access issues. I think we still have to think about rural areas in creative ways, just because like I know food access is very different in rural communities than it is in urban areas, having grown up on a farm in West Central Minnesota. And so I think there's a lot here, and I think that the next 3 years or so should be really cool to see where things end up.
All right, thank you so much. Our next question is for Jennifer. What opinions do you have regarding using insects for more sustainable protein production? It was announced a few days ago that Tyson Foods, one of the world's largest food companies, has reached an agreement with Protix, the leading insect ingredients company.
Yeah, I've actually toured one of their facilities over Europe. Not Tyson, the Protix. It depends. I think that there's a lot of great potential thinking about insects. Most of the world eats insects, and the US, we have this weird history of not for many of us. The jury is out on the early studies on really the environmental impact savings from that. There's likely to be environmental impact savings. But again, kind of the best science is still cutting edge in that space. And so I'm not going to like, it's a tenfold or whatever. Like, I can't say that right now. I think we need to kind of like with the Uber Eats, need more research in this space. I think there's a lot of opportunities of having insects be an intermediary to animal feed, actually. Not even necessarily just right to humans, but like having insects or frankly fungus deal with food waste and then feeding them off of that, and then feeding the insects to animals and then having us consume them, I think can have a big environmental impact. So in general, I'm all for it. I did have some crickets at Awamni almost a year ago now, and they weren't that bad.
Okay, good to know. All right, very good. Our next question is for Abby, and that is, what is the current understanding about white pasta and its nutritional value? Is pasta part of the Mediterranean diet?
I think pasta's been demonized and it's so delicious. And so, like anything, you would eat it in, not every day, and you eat a smaller portion size, and you enjoy it as you would any other food. And I would say, yes, I do not know for sure, actually, if it's part of the Mediterranean diet, but it's certainly part of, Italians' diet, and they're part of the Mediterranean and part of the Mediterranean diet. So, like when you look at pictures of the Mediterranean diet, they don't always feature the pasta, but it is in there. And so if you like whole grain pasta, give that a try. That's going to have a lower effect on your the rise of your blood sugars because of the fiber in the pasta, slowing down the absorption of the simple sugar, the glucose. But I would say enjoy your pasta, eat it like you would any other food, on occasion. Don't eat it every day. Or move to Italy. I don't know, I'm just teasing. But that's all I'll say about that. I think if it's something you enjoy, eat it, but think about, how much you're eating and how often you're eating it, if that makes sense.
No, I think that's a great perspective. And my patients actually ask me about pasta a lot, and I agree with you. It's been demonized. It can be healthy, especially if you add it with a lot of fresh vegetables and more of a tomato-based sauce as opposed to Alfredo cream sauce. And then also keeping in mind portion sizes, not a huge plate, but just a very small portion with a lot of fresh vegetables and some olive oil. It can be a really nice dish.
Thank you for that addition. Amy, I also wanted to just say about bread too, because the Mediterranean diet includes a lot of bread, sourdough breads, and other people from other cultures eat a lot of bread. So, and it's the same thing, like what you put on your bread and, how you honor it and make it. And so I think those two foods kind of fit in the same category.
Absolutely. I agree completely. All right. So this next question is from Melissa. Should we also address clean water insecurity?
I think there's a lot of things we should address, and I think clean water is clearly, like, again, basic need and of very much importance.
Okay, great. Our next question is for Jennifer. What is considered farmed shrimp and fish? And how do you know if you're purchasing farmed shrimp and fish?
Pushing a little out of my super comfort level. Although if you're farming it, you are keeping it contained in a particular area and feeding it additional food. Feed is what you're feeding it. The same way we give feed to chickens, if you will. And so that would then be farmed aquaculture as opposed to like wild caught. And we now have to at least say where it's come from. I guess I'm not sure if it then indicates if it's wild caught or farmed. Although I'm thinking back to the salmon I usually buy, and it's usually labeled that way. So we've got much better labeling and frankly traceability into shrimp and fish than we do, say, meats, our other meats in this country. And I guess the only final thing I'll add, because it also was thinking about it for the question that Abby answered about fish, like the Marine Stewardship Council has an online guide about like what fish are coming from overfished populations, what fish have high mercury levels, what fish are potentially farmed, although not all farmed fish is bad, I will put out there. It can be a much more environmentally safe way to get some of these fish rather than pulling them out of the ocean with all the bycatch. So like it's nuanced. It's depends. So I'll stop there.
Okay, thank you so much. This next question is for Abby. Can you comment on the benefit of adopting a truly plant-based diet, eliminating meat and dairy, which has been shown to influence cancer growth? I'm thinking of work of the China study, etc.
I'm not familiar with the China study, but I would say that people can live a very healthy lifestyle without eating animal products. But there are certain populations that need to take care, specifically pregnant people and older people who usually have lower calorie intake, but the same nutrient needs. I saw that was a question on one of the questions about older people and what they should eat in terms of the nutrients. So yes, I think you can, and I know you can eat a healthy and maintain a healthy lifestyle without eating animal products. The Mediterranean diet does have animal products in it, and it's just but fewer animals and smaller animals. That's another thing that we didn't talk about. I think Jennifer showed the slides about the beef in the herds, taking the amount of energy it takes to create beef is just it's kind of outrageous, when you think about it. So eating smaller animals, if you're concerned about the environmental impacts. So the answer is yes, you can eat and be healthy on a vegan diet.
All right. Yes, I absolutely agree. In the patients I see, I think one of the single best things they could do for their health is eat more plants. It'll help your blood pressure, your cholesterol, lower risk of diabetes, lower risk of cancer. It's just one of the truly best things to do for your health. So definitely plants. All right. Well, we are out of time for tonight's session, but I really want to thank all of the panelists for their time, their knowledge, their expertise, and then you as the audience for your attention and interest in our mini medical school. And I want to remind you that next week we'll have our second installment of Mini Medical School, answering your questions about cannabis, psychedelics, opioids, and alcohol, which will be at the same time next Wednesday. And again, we have an amazing group of experts that will discuss common questions on these different substances, including medical and recreational usage, long-term impacts, and substance use disorder. Thank you so much and have a great night.